Dear friends, violence against the doctors is an urgent problem in our society at present, and immediate attention is required for the same. My humble tributes to Dr. Archana Sharma. A brave heart may die for a cause, but after his death, the idea reincarnates into a million lives and brings about the revolution. Dr. Archana, you may not be physically present among us, but your sacrifice won't go waste. It will be an inspiration for all of us to fight against this evil. Master blaster batsman Sachin Tendulkar may be successful in 99 matches, but in one match he may be dug out. It may not be right to presume that he did not try his best. Maybe the ball was so cleverly put, so timely taken that it left the batsman clueless. Had not been this eminent delivery, Tendulkar may have won another match for his team and the country. But you think, what an irony. The same deed, failure to deliver at a delivery, in the batsman's case, may cost him a maximum of a match or a series, but in the doctor's case, cost her life. This situation must be urgently or dealt with after a few years. Your smart daughter may refute your decision to follow you into the medical practice, or your fully equipped wife refuses to take the challenging cases at all. Our ultimate goal is not only to make doctors safe and Dr. Archana's case as the last case of violence against the doctors, but also to gain the reputation of doctor community as the strong pillar of society infrastructure with abundant faith, trust and worship. We fairly believe that doctors and healthcare professionals are indeed trusted as divine souls who not only burn the midnight oil with the flame of their devotion and commitments, but also sacrifice all their sensory pleasures, including commitments with friends and family and high quality time. Not only these, they have to suffer enormous physical, mental, and emotional crackdowns before they can finally master to crack the hard nuts of disease, depression, anxiety, fear, and emotional paranoia. Doctors and other healthcare professionals not only provide health benefit to the society, but at times they have been proven leaders. We cannot forget the anti-reservation campaign started by the doctors in 2007 against an irrational caste-based appeasement policy of that time government. Many of us shredded their personal gains against for a bigger societal gain, and the next in queue was the Anna Hazare anti-corruption movement, in which also the doctors played a pivotal role. Not more than 3 to 4 decades back, films like Bahu Ki Awaaz inspired all of us against the exploitative attributes of the society. against the soft targets of our newlywed brides. The matter was adequately put up by the NGOs and other social organizations, and the government was pressurized to pass an anti-dowry law in 1988. And now you can see its effect. The incidents of dowry are almost unheard. But the exploitative attributes have again raised their ugly head, this time against the soft target of doctors. So this time we have to again pressurize the government for passing laws empowering the doctors. The government must pass stringent laws to clinch the wings of the media if they spread them out too far, just for publicity gains, rather than streamlining on truth by passing an urgent malafide intention hospital defamation act, or maybe act of contempt of savior 2022. At times Sunny Deol dialogue Tariq pe Tariq, Tariq pe Tariq becomes an eventuality in our healthcare system, particularly the government sponsored healthcare system, and immediate efforts by the government are required to not only allocate more percentage of GDP to health care system, and but also inviting other corporate giants like Tata and Reliance to boost up the government sponsored healthcare system. Besides that, they should incentivize the newest healthcare startups by providing easy loans, total technical and logistic support. The interaction between the government and the healthcare should be very congenial. The healthcare professionals should also trust the government and the democracy. They should believe in the judicial system and go for judicial help in case of any emergency rather than getting feared about it. When the rules of the game are very complicated and different from others, we need to simplify and integrate the system. Hence, it will be a very good idea to have separate medical codes as analogous to army codes, which are different from the civilian codes. To understand the problem at a deeper level, we must first understand the emotional aspect of the patient and ways to tackle it. We are amazed to see Sardar Vallabhbhai Patel addressing a running, angry, armed, emotionally charged mob ready to kill and pacifying them, or Mahatma Buddha shrinking the robust, aggressive, annoyed Angulimal to folded hands. How can this be possible? The answer is in relieving the emotional pain and clearing the doubts thereof. During sickness and medical emergency, the patient and their loved ones are also emotionally distressed due to numerous factors. It has repeatedly been seen that long queues in the hospital, lack of communication from the doctors, and opaque billing system are important predictors of violence in India. We can definitely try to listen to patients and their loved ones without interruption and reduce emotional pain by avoiding a long waiting time, words of compassion, concern, and ready to help attitude, but simultaneously describing the medical situation of the patient. And once in a while, we may ease out the financial burden of the dissatisfied and deprived patient. All efforts should be made to reduce the emotional pain of the patient by empathetic listening and understanding. Emotional wounds may not heal easily or faithfully. The emotional pain concept finds significance from history because high time philosophers have ascertained the traumatic cause of death for a reverend person like Mahatma Gandhi, who is considered the embodiment of pure love and non-violence, because he could not prevent emotional pain to certain sections of the society. To stop violence against the doctors and medical community, we must learn how to act appropriately at the right time and also not to react. It is essential to remain alert, communicate at every step during the treatment, and watch for the signs of aggression and violence by patient or his relatives. Certain small steps by the hospital can definitely be fruitful in preventing the violence. First is the restricting the entry in the emergency rooms and other areas of the hospital. Limited number of visitors should be allowed and visited passes should be given to all patients and their relatives. Stricter security must be implemented to ensure only the individuals with passes can enter. Guards should be on duty 24 hours and sensitive areas of healthcare like casualty, operation theatre and intensive care units should be complied, and good CCTV cameras which can give a good detail of all the incidents should be installed. Besides the notice depicting that you are under the vigilance of a CCTV camera, certain other security expenditures can be valuable in the long run, like taking an indemnity insurance, clinic hospital insurance, employing proper security at the hospital all around, and audio visual counseling, health bulletin rooms. At no point of time should hordes of visitors be allowed at the patient's bedside. Needless to emphasize the value of informed consent. Taking an informed and valid consent from the patients and their family members, preferably in their own handwriting, and countersigned by two witnesses after a detailed explanation about the prognosis, treatment outcome, the need for repeat surgery, the cost of treatment, all the pros and cons of the treatments, the treatment alternatives, and consequences. Properly should be communicated verbally as well as through the consent to the patients and their associates. Deeper understanding of the negative aspects can be done by impressing upon the obliged party with some examples. Both digital and mobile technology can substantially help in improving the patient communication. And the next is documentation. Proper documentation of the patient, which starts from the time when the patient is coming to the hospital for treatment and should continue till they are discharged. The documentation not only helps to understand the ins and outs of the cases easily, but can legally defend the doctors from the judicial queries in case of a medico legal court case. Every hospital must formulate a vigilance and violence protection team and educate its doctors and staff members what to do in case of aggression and violence or any emergency. By weekly or monthly full dress rehearsal according to standard operating procedures SOPs as necessary, and may take the help of technology like rescue WhatsApp groups and emergency alarms. It should be remembered that a soldier who sweats more in practice may bleed less in war. So either you lose sweat in practice or you lose blood. So it's always a better option to spend some time in practice. Local IMA bodies should take the lead and provide instruction courses on these as per necessary. In all hospitals, posters conveying the message that the vandalism and violence in a hospital or clinic premises is a criminal offense must be displayed at prominent places. I want to repeat the importance of street plays and mock drills and the practice of constant emotional empathy, because the practice of emotional empathy, empathetic listening, and remaining composed and calm in a difficult or tight situation, and avoiding any altercation that may escalate the situation may be effective 99% of the times. Doctor-patient relationship can definitely be enhanced with the explanation and rational communication with the whole family about what is going on. In case of difficult situations, your family and your near and dear ones may provide emotional and psychological strength and solutions to face adversities like these. Always remember Acharya Chanakya's words that failure is not the destination, but a launching and learning station for the next success station. So don't be upset with the failures. Sometimes a little help from a senior doctor may be useful, which may be in the form of uh, audio or video conferencing or a second opinion. A proof of the treatment by Dr. Google can also be sometimes acceptable for the patient. So the next question is, what can doctors do to have control over the media? So the doctors need to sensitize the media to avoid publishing sensational news. For a balanced view upon an incident, doctors must ensure that their version of the event is also published by the supportive media options. Next important forum for prevention of violence against doctors is the medical colleges and medical fraternity. One should never be hesitant to reach out to one's senior colleagues for advices and for help, those who are more experienced than you in dealing the matters. The same culture can be carried forward from the medical colleges to the private practice. The different roles that doctors meeting body IMA can play to save its fellow doctors are: number 1, it can organize street plays at the meetings and in medical colleges, demonstrating what is to be done in case of an emergency. Number 2, it is the best forum for inculcating mutual respect and pride among its fellow doctors by discovering occasions like particular achievements or initiation of new ventures, or even birthdays and marriage anniversaries, when the doctors praise leniently their own colleagues. The best impact is by physical maneuvers, but digital maneuvers are also welcome. Number 3 is taking initiative to resolve the doubts and questions or challenges faced by individual members and discuss them as a group activity for best of the mutual learning. It is the strong forum for putting the cause of doctors against the juggernauts of politics, bureaucracy, and judiciary, and even media. Remember, unity is strength. It is only the unity by which we can face these unfeared. It is really a platform to nurture healthy medical fraternity and making aware of fellow doctors how severely the mudslinging on each other for any personal and professional gains may harm the unity, dignity, and integrity as well as reputation of medical fraternity. Number 5, because the learning is endless. So, motivating the specialist doctors to collaborate each other, learn from each other's mistakes, and progress as a community or as a medical hub, despite retaining the difference of opinions. It can definitely initiate sessions on yoga and meditation for attaining emotional calm and maturity. Resolution of the problem is anyway only by understanding by its roots. So it can conduct sessions on awareness of medico legal laws by an expert. This will come out as a preventive aspect of the problem and may not need cure. IMAs can deliver effective rescue measures by uh, deciding upon the blueprint of emergency rescue WhatsApp groups and other call to action measures. Now, in the last, I will take a minute to revise what we have already discussed. So, the main point is that failure is inevitable in any profession. So, utilize the failures as an opportunity for learning and launching yourself for success. Don't get emotionally deprived by the failures. An important tool for digesting failures are deep and meticulous understanding of the problems and emotional empathy, and definitely a system for training of these should be started at various levels. We definitely need government's help for empowering us against our problems and also deeper understanding of the situations. The hospitals should allocate a small budget for safety and surveillance protocols. Unity is strength, and all the big hurdles and the biggest challenges can be solved only through unity. Maintain goodwill to all your senior and junior colleagues, while competition can be handled as a sport rather than emotionally being carried away by it. Lastly, my humble request that if you think this podcast can really help us stimulate solutions and help us reach our ultimate goal, please share it in large numbers. This presentation is by Team Agarwal Eye Care Hospital, Gandhinagar, Muradabad. We are dedicated not only to the site but also to the vision. Sincere thanks for your patient listening. Jai Hind.